mentioned that was your first line. Where would you go maybe after that?
Yeah, so if we think of the knee as, the knee itself is effectively like an incubator, and the PRP, or the platelet-derived growth factor, is really stimulating your own natural cells. It's working on the natural cartilage cells. But where patients have less cartilage, where their degree of arthritis is more, you really need more cells for that to work on, and that's where the stem cells, or again, that word is sort of bantered around a lot, and generally what we call them is messenger signaling cells is the actual correct term, but for general public, we stem cells is what's known out there. But effectively, you want to you're looking not only to add the catalyst, but you're actually looking to add cells to the equation within the homeostasis of the knee. That's where techniques such as bone marrow aspirate, where you're harvesting stem cells from the actual bone marrow, usually from the iliac crest, or from body fat, which is typically the case with techniques such as lipogem, or stem cells, which pure stem cells, where we obtain their allogeneic stem cells, effectively from umbilical cord.
And again, this would be an injection, would it be, Joyti?
That's correct, yeah. So again, it's very straightforward. In terms of depending on where you're harnessing cells, if you're using allogeneic, then you would effectively order it, and then you would be processing, injecting it back in the knee. Yeah, so if you're harvesting it from bone marrow or from body fat, that would obviously be a day case procedure. The body fat we do in combination with a plastic surgeon, where we're harvesting around 50-60 cc's of body fat from the abdomen or from the upper thigh. Bone marrow be an aspirate from the iliac crest. And again, both are relatively well tolerated. We've done them even under just local anesthetic, and then processed and put back into the knee